Everybody, welcome back to another episode of Medical Monks Webinars. Today we are joined by Beth and Jeffrey Gusenoff of PopSole. They're going to go over how to treat your feet and feet pain, and also introduce their innovative product, the PopSole inserts. So without further ado, before we go any further, if anybody has any questions or anything like that during the webinar, please feel free to put it in our chat, and I will keep note of those for the Q&A session at the end of the webinar. Now, without further ado, Beth and Jeffrey, you guys can take it away.
Thank you very much.
Okay, thank you, Jordan. We are excited to be here today to discuss some different foot conditions with you and the mechanics behind the foot problems, and introduce you to our insole, the PopSole, that can help alleviate some of your foot pain. So let's see. So I like to start with a little trivia because I think we put our feet in shoes and we take our feet for granted. And I guess I'm biased being a podiatrist, but the feet are really miraculous. So did you know the average person will walk around the entire earth about 4.5 times in a lifetime? The foot has 26 bones. It's the most number of bones in any one part of the body. And the foot is divided into 3 sections: the forefoot, the midfoot, and the rear foot. And each section is unique unto itself, but dependent on one another. And then the entire body is dependent on how you place your foot when walking. Did you know that foot pain is not normal? There is a difference between tired feet and painful feet. And when your feet hurt, you can hurt all over, physically and emotionally. Because when you injure your foot, you begin to limp. And when you begin to limp, you can throw your body out of alignment. And you can injure your knee, your hip, your back. And when your whole body hurts when you're trying to do something you love, it can become depressing. So as the song says, the foot bone is connected to the head bone. 80 million people in the U.S. per year have foot pain due to hours on their feet on unforgiving hard floors, due to bone bruises, calluses, blisters, heel pain. That's probably the most common condition that we see coming into the office, tired feet, pinpoint pain. So what actually causes foot pain? So there's the obvious cause of acute injury, such as an accident or trauma that you have fractured bones or torn tendons. Some of the more less obvious causes are foot type and systemic causes. So let's review foot type. There's 3 main types of feet. There's the rectus foot, which is the perfect foot. You have a normal arch, well-aligned forefoot, midfoot, and rear foot. But only 7 to 13% of the population have the perfect rectus foot. The remainder of the population has either the cavus foot, which is the high arched foot, or the pronated foot, which is a collapsing or flatter type foot. So the cavus foot, this is an abnormally high arch. There's very little shock absorption when walking. It bears weight on the forefoot and the heel throughout the entire gait cycle. This foot may be seen with hammer toes or heel pain or fat pad atrophy, because if you're putting a lot of pressure on your forefoot and heel, when you overuse these areas, the fat pads underneath will start to wear down. This foot is more susceptible to ankle sprains or Achilles tendonitis. And then you have the other foot, the pronated foot, the more flexible type foot. This foot collapses on stance and ambulation. So if you look at this top picture here, you can see the ankles are starting to roll in. At the bottom left picture, you can see the Achilles tendon take on the shape of a C. The Achilles tendon should be straight up and down, but when the foot starts to collapse and the ankles almost start to kiss, this is the pronated collapsing foot. And hyperpronation can cause muscle imbalance. So certain muscles are stronger with this, certain muscles get weaker, and tug and pull the bones in different directions. And you can develop different bone deformities, as we see on the bottom right here. You can develop bunions or hammer toes, or soft tissue inflammation that we see with plantar fasciitis or tendinitis. So I like to refer to this concept as the foot tug of war. As I mentioned before, we have 26 bones in the feet with over 100 tendons, ligaments, and muscles holding all these bones and joints together. Well, then add the high arch forces onto this, or that collapsing pronated foot forces onto this. And you start to develop a tug of war of all these soft tissues on the bones and start to change the shape of the bone. And some of these bone deformities include like a hammer toe. We see in this top picture, the toe begins to buckle. This buckling toe starts to place a retrograde force on the bone behind it, pushing it down to the ground. Or in the second picture, you can see a bunion or hallux limitus. So this muscle imbalance is causing that first metatarsal bone to elevate, and the toe is trying to get up and over, but it can't. It jams into it, and you start to see some spur formation. Or as we see in the bottom picture, calluses. So as more pressure starts to build on the bottom of your foot, the skin doesn't like that pressure, and it tries to protect itself, and it builds up more callus. And sometimes when these calluses get too large, they become quite painful. Some soft tissue type of inflammatory type changes are plantar fasciitis. What is plantar fasciitis? It is the most common cause of heel pain. 2 million Americans are affected per year. 90% do respond to conservative treatment, but 10% go on to become chronic plantar fasciosis. So here we see the plantar fascia is a ligament that goes from your heel to your toes. When your foot walks without support or constant hyperpronation and flexibility, that plantar fascia can pull on its origin at the heel. The heel doesn't like being pulled at, so it starts to develop a balloon of inflammation in the area. If the plantar fascia keeps pulling, it can even pull bone away from the heel, and you develop a heel spur. So common treatments for these musculoskeletal problems are usually what we call the method of Rice. For the acute pain, we use the Rice method, rest. You rest the painful area either by taping it up or going into a cam walker or crutches. You ice the acute injury to help take down the inflammation and the pain. Compression, you can use an ACE wrap or a splint to help milk out some of the swelling. Elevation gets you off of the painful area and also eliminates the gravitational forces that bring more swelling into the area. And once you try to get that acute pain down, then you may want to consider physical therapy, which is stretching that helps rebalance the muscles, strength, flexibility, and function. As I mentioned, many of these injuries happen because of that muscle tug of war and that loss of muscle balance. So physical therapy can help rebalance those muscles so that you don't re-injure yourself. Orthotics are another option that help to try to rebalance the muscles. And soon you're going to learn about our PopSole, which is another option for treatment. And surgical treatment, if all these conservative measures fail to relieve the symptoms, you may consider surgical treatment. There's also systemic issues aggravating foot pain, such as weight gain. 3 times your body weight goes on your feet when you walk. So if you gain 10 pounds, that's 30 times the force, that tug of war force, which is going to aggravate the symptoms, to the bone symptoms to happen even more quickly. Arthritis, osteoarthritis, rheumatoid arthritis, they affect the bones, the joints. Diabetes, elevated sugar may have significant consequences on your nerves, blood vessels, skin, and bones of the feet. By the time your nerves and blood vessels reach your feet, they're the tiniest. So when you have elevated sugar, these teeny tiny blood vessels and nerves are very susceptible to injury. So here's some x-rays of an arthritic foot versus a normal foot. On the right-hand side, you can see the normal joint. You have a beautiful equal joint space. Everything is nicely aligned. This foot can get up on their toes very easily. There's no restriction in that joint. On the left-hand side, you can see there's no joint space. The joint has collapsed. The bone is diseased. There's spur formation on the top of the bone. And if you look, the foot, you can actually see a bump on the top of the foot. This foot is unable to elevate up on their toes, cannot walk normally, and it throws off the whole gait. Diabetes. 1 in 10 Americans have diabetes. Every 1.2 seconds, someone develops a diabetic foot ulcer. 40% of people with an ulcer reoccur within a year. About 50% of adults with diabetes will develop neuropathy in their lifetime. So what is diabetic neuropathy? Well, there's motor neuropathy, where there's decreased function of the nerves to the muscles. So then you develop muscle weakness. And then that goes back to that tug of war. Certain muscles become stronger, certain muscles get weaker, and you develop different foot deformities, again, like the hammer toe. But here, when we see on this patient, they have the retrograde force from the hammer toe pushing down on the bone behind it. This person has developed a callus, but with the neuropathy, you don't have that protective sensation anymore. She has lost the feeling to feel the painful callus, and it can get deeper and deeper, and you can ulcerate. Also, autonomic neuropathy. So the autonomic nerves of the foot control moisture and temperature. And so this person with the autonomic neuropathy has a drier skin. They develop cracking and fissures. This is the perfect portal of entry for bacteria and infection. And there's temperature changes with autonomic neuropathy. That's why sometimes you hear when somebody has neuropathy, they have burning in their feet because of the temperature changes. And this just creates the perfect storm. You have loss of protective sensation. You develop foot deformity. Shoes, sometimes you're wearing shoes that are too tight or too loose, but you can't feel it. And it just continues to cause a problem until the sore becomes an ulcer.
The problem with foot pain is that feet are essential. Without your feet, you can't walk, you can't work, you can't care for your family or for yourself, and you can injure other areas from limping or from gait disturbance. So prevention and hastened healing are really essential. And that's what led us to develop the PopSole. And PopSole is an instantly customizable, affordable, revolutionary insole system designed to enhance comfort, recovery, and performance for various foot conditions. So just to give you a little bit of background, Beth's a podiatric surgeon. I'm a plastic surgeon. And together we've been innovating areas of fat injections into the feet. So I do liposuction, and then we inject it into the foot for either loss of the fat pads in the ball of the foot, the heel, or for chronic plantar fasciitis. Sometimes we use off-the-shelf fillers or other products. And one of the key things is that we want to offload these people so they can get back to work sooner. And so Beth was basically using these pads, trying to MacGyver her way to offload these people. And people would come in with buckets of insoles that they've had custom or off the shelf that they tried to really MacGyver their own solutions to offload their areas of pain. And so we just basically thought, wouldn't it be better if we had, something easier for people to use? And so we basically thought that something like bubble wrap for the foot would be a really great idea. And that's what led us to develop the PopSole. So the PopSole, you can see here, comes as a kit. It's easy to use. It's a trim to fit design. We currently have 2 sizes, a small and a large. It has an adjustable arch and metatarsal pads. There's actually a little notch underneath. And you use a little push pin that comes in the kit to pop that bubble, and you can deflate the height of the arch or metatarsal pad. If someone has a flatter foot and finds it obnoxious, you can lower those areas down. It offers cushion and support. You're literally walking on air versus a lot of the other insoles that say they're air are really just cushion. We have targeted offloading, so you can customize to offload the specific area you want to treat. It fits in standard footwear, so you don't need a special surgical boot or shoe. You can go right into a stable sneaker. You can have the ability to keep this waterproof. So you can actually put this in a slide and wear it in the shower, or they don't slip. So you can actually put it in the shower on the floor and they won't move. So if someone has really sensitive feet or wants to continue offloading in the shower, it's a great option. It also keeps you balanced rather than just being on one foot. You put this in both your shoe gear. You can offload them differently, so you can customize them differently if your foot has variations from side to side, and they're very versatile. How the system works is you mark it, pop it, stick it. So you can hold it up to the foot. It comes with a marking pen. You mark the area where your pain is or your pressure point, and then you take it, put it on the table, you pop the bubble that corresponds with your pain, deflate that, and then put a sticker on it. The sticker is also waterproof. And then you basically remove your current insole and put the PopSole in. And we have a little video here. We're going to have Jaden hook that video up. For the PopSole, you mark it, pop it, stick it. When you hold the device up to your foot, you can mark the area where you're having pain. If you have pain at the base of the second metatarsal, you mark that. You then take a push pin and pop the bubble on the back side of the device. From the front of the device, you work out the air. Once the bubble is deflated, you stick it with a sticker. Okay, there we are. All right, so just to give you a little bit of background on our innovation and how we developed this, we developed this at the University of Pittsburgh, and we did a lot of customer discovery to find out what people needed. We did modeling, functional prototyping. We've conducted clinical trials. We make them here in Pittsburgh at Pittsburgh Plastics up in Butler, PA, and we've gotten funding through multiple sources to get us to where we are, and also participated in the Coulter Translational Research Program at the University of Pittsburgh. And so we initially did some technical and feasibility studies, and we really designed this to be optimized. So we worked with bioengineers at Pitt to optimize the bubble shape, size, and materials. We really wanted to avoid the edge effect, which you find in other devices that have a sharper cutoff with foam. So the nice thing about the plastic with the bubbles is we can keep a smooth contour and prevent the areas around the ulcer or area you want to offload from having increased pressure. And we published that data. We then wanted to look at comparing our device to the Darko with the Pegasus, which we really consider the gold standard of offloading here. So we gave our devices to the UPMC sports medicine team, who then conducted trials to compare it to that device. And what they demonstrated was that there's pressure relief, improved gait stability, and preference for the PopSole versus the Darko Pegasus. And what's nice is that it really keeps you balanced because you're putting it in both shoes rather than being off kilter with that big Darko shoe. And we also looked at clinical safety, durability, and effectiveness. We ran a 1-month clinical trial and showed that the PopSole rapidly improved pain, function, and sustained relief. But no one wanted to give the device back after a month. So we then started a whole new trial, and that one lasted 3 months. And we really thought that 3 months was a good time point for people to heal their foot pain or whatever their acute issue was. So we did that study, found the same results, and published that as well. So both of those papers have been published in peer-reviewed journals. The value proposition is that it's a very versatile product. So you don't have to pop it. You can give it to people just to wear for comfort. And I wear them for comfort in my sneakers, especially when I'm touring cities, walking around the neighborhood, or whatever. You use it fully inflated for foot fatigue and for shock absorption. You can wear bubbles up for that massaging feel, or you can flip it and reverse it and have that smooth surface, but still maintain the anatomic benefits of the arch support and the metatarsal pad. You can cut and craft custom air-filled forefoot or rear foot pads. We have a podiatrist down in the Virginia, DC area that likes to cut just the forefoot and put it in a low heel for comfort of the forefoot. You can place it in slides for home walking and evening transfers to the bathroom. So one of the big issues for diabetic foot patients is ulcer recurrence. And what happens is compliance at home really goes down because people don't want to get into their bulky shoe gear to get to the bathroom in the middle of the night or to go to the kitchen or whatever the need is. But with PopSole, you can put it into a nice slide or something, and you have instant offloading that's very easy to get around. So hopefully we can reduce ulcer recurrence or keep that remission rate going longer with this type of device. It's more than an insole and a case. It's really a system for foot rehabilitation. We've given this to a lot of people over the years, and what we have shown is that this is a patient who has cuboid syndrome and plantar fasciitis. He's an avid pickleball player and was having a lot of pain with that, but the PopSoles allowed him to increase his pickleball play time for an extended period up to about 3 hours, and now walk 18 holes of golf. And so he says that the PopSoles really play a significant role in relief of his foot issues. Another patient said that they had aching and soreness almost every day that went away with the use of the PopSole, and almost noted an immediate change in the discomfort, and within a short time was pain-free. We have physical therapists who like this up at Lemieux Sports Center and think that it's great for patients transitioning out of bad injuries and like the versatile nature of the device. And then we have some other physicians that state that, it's great for a clinician who needs to temporarily offload an area post-procedure. And another clinician said that it can relieve the pain and pressure points, and the design is genius and that it works. So some more versatility. You can put this in the slide or a shoe. It's great around the house. Recovery from fancy shoes. So if you have patients that need to spend the night in a high-heeled shoe, it won't be great in a high-heeled shoe, but when you need to recover that foot from the pain of being in high heels, it's great. You wear it as a pair so it keeps you balanced and prevents the limping and the compensatory knee and hip gait abnormalities that you may have. This just shows it going into all different types of shoe gear. So again, more versatility. And, here we have some people that have really enjoyed the PopSoles. The nursing staff in the hospital really loves it. They think they're great stocking stuffers as well. So if you have people that you need gifts for during the holidays, now's a great time. And then in the middle there is our pickleball player who actually won a senior championship wearing our PopSoles. So basically, work and play and comfort is really critical for physical and mental well-being. So thank you for your time, and we are happy to take any questions that you have.
All right. So thank you guys so much. I can tell you, I personally want to try it. So I definitely can't complain about that. Once again, like they said, if anybody has any last minute questions or anything like that, please feel free to throw them in the chat, and we can certainly ask them. I know I have a couple of questions that I wrote down for you guys while we wait for some to come into the chat. So I'll go ahead and ask one now. You guys may have answered this in the PowerPoint as well, but obviously, if you want to go over it again, how long do the PopSoles last?
Thanks, Jordan. So it really depends on how much you're using them. So for like me in the clogs that I use in the operating room, I'm only in them about 3 times a week, but I'm wearing them all day long, going all through the hospital. And honestly, I think I've had them in there for a year and probably are due for new ones. But we recommend replacing them after about 3 to 6 months. Most people are reordering around that 4 to 5 month time point.
Okay. Cool. And actually, Carla threw in a question here for us. She asked, will this product alleviate the burning sensation on the balls of my feet when walking?
So they may. It depends what the reason is for the burning. But they definitely can help. If you have burning because there's loss of cushion, then that they definitely can help with that. What we have found too, generally are people like our diabetics who have burning in their feet, or people with back pain that have burning in their feet. they enjoy the PopSole flipped and reversed. So they like the PopSole flat side up and then enjoy the bubbles and air on the bottom. Sometimes having the bubbles up when you have burning feet, the bubbles can be hyperstimulatory. Jeff and I personally like bubbles up and the massaging type feeling, but if you have nerve type pain, bubbles down or flat side up, bubbles down, and they can help offload the pain.
The bubbles up is almost like a reflexology. So you get that stimulatory feel, which is what I like. I tried them flipping in the smooth side, but the bubble side is my preference.
But the nerve people like the flat side.
I think that should answer Carla's question. And Carla, I can answer your next question. She said, what is the price and where can it be purchased? Well, we do have it available on our website on medicalmonks.com. So if you just search PopSole, you can find it on there, and it comes in different sizes and everything like that. And they're $64.99 for a pair. So feel free to take a look on our website, and that's where you can find it, Carla. Another question that I had written down for you guys. Obviously, whenever you're trying to get it set and everything, if you have to pop a bubble, are you able to reinflate a bubble, say if you make a mistake punching a wrong one or anything like that?
Yeah, so they actually are reversible if you notice that you pop the wrong one soon after doing it. So if you pop it and you put it in and you feel it and you're like, ooh, that's not right, I really would rather have that reinflated, then remove the sticker, massage the bubble a little bit and let it sit. And after a few minutes, it will spontaneously refill. Then put another sticker on it so that it stays inflated. If you wear them for an extended period of time, then it will not reinflate. So the insoles will mold to your feet over time, and the bubbles will sort of deform to your foot shape and provide cushioning support that way. Even if you look and think that your bubble has deflated, if you feel it, there's still going to be air in there. Even the ones I've had in my shoes for like a year still have air in them. But you will lose a little to the stretching of the plastic. But yeah, you can reverse it if you need to, but it has to be done quickly.
And also, this is a common thing. When you cut the PopSole to fit into your shoe, it's okay if you cut through the periphery bubbles and they deflate. Your feet really aren't touching those areas.
Gotcha. All right. It looks like Shirley has a question here as well. She says, how can these help me? I'm not a diabetic, but I have a wound that has led to a medial rotation in one foot. So her gait is painfully awkward.
Well, I don't exactly know what is going on with your foot, but if with an abnormal gait, if certain areas of your foot are getting more pressure while others, are not, the PopSole will cushion that area of high pressure and limit wounds from coming or help heal, wounds, because it'll decrease the pressure on that area with the hyper amount of pressure.
Okay, I thought there was another question in the chat there. So I had another one. One of my colleagues actually asked this one. How can I help if my calluses are growing back so quickly?
Right. So you can get the calluses get shaved off, and then because of pressure, they start to come back really quickly. So perfect. You hold the PopSole up to your foot. You line up the PopSole with that callus, mark the exact bubbles that correspond to that callus, pop those areas, and then that callus will not get any pressure. It'll be floated in this area and won't touch the ground. And also, just another quick tip, then if you put a little Vaseline petroleum jelly on that area, which will soften it and decrease friction, in conjunction with the PopSole that's cut out for that area, that would help slow the return of the callus.
Perfect. All right. And Shirley, to answer the question again, you can get them on medicalmonks.com. So they are available on there to purchase. I had one more question that I had written down. Just making sure no one else said any others in the chat here. No, okay. And someone asked, why does my heel hurt when I first get up in the morning after resting all night?
So that is a main symptom of plantar fasciitis. So, right, you've been off your foot all night and you're like, why should my foot hurt? But what happens, that plantar fascia, that ligament that goes from your heel to your toes, has built up a balloon of inflammation right at the intersection of the plantar fascia on the heel. So you go to bed at night and you're off your foot, and that balloon of inflammation somewhat decreases, but it doesn't go all the way away. So that first step in the morning is that first pull on that balloon of inflammation. That plantar fascia tugs on that heel, and you basically like limp until things warm up and loosen up for you. So that is actually a telltale sign that you have plantar fasciitis, when your foot hurts from getting up from a seated position or first thing getting out of bed in the morning.
And if I get a flare up of plantar fasciitis, which rarely happens anymore with my PopSoles, but I put them in the shower because that first thing in the morning is so painful. Putting them in the shower has made that a much more enjoyable experience, because that hard floor in the morning is just brutal. So they will not move in the shower. So you have to like plant them and stand on them. And if you want to change your direction in the water, you have to bend over, move them to where you want to position them for standing. But either that, or you can put them in a water, like a slide, to stand in the shower. Some people even use them in flip-flops, and you can actually cut a place for the, the thong part of the flip-flop. People are really playful with them and versatile. So,
but the arch support of the PopSole, so that will limit that pull of that plantar fascia. It'll put it at rest and stop it from pulling, and then the bubbles will rest that area of inflammation.
Looks like that may be all the questions we have. I can tell you just from talking with you guys and the presentation and everything, it's a very customizable item. So whatever your condition is, you can customize it to your fit. So like I said, I personally might be trying out a pair, because whenever I'm walking around, I like to go to theme parks and everything like that. Walking around it all day, it definitely starts to hurt on the feet. So I'm sure this will definitely help with that. So I can attest for it as well.
I think it's also kind of interesting that a lot of people do buy them for other people, like family members or whatever, because there's not too many insoles that you can just go in and pick something off the shelf and be like, oh, I'm going to get this for, Aunt so-and-so. It's something that is so versatile that really you can get it for a family member or a friend, and they can customize it to themselves. And it's very, great in that way.
Yeah, absolutely. All right. Well, I think that should just about do it. We wanted to thank everybody for attending today. We will have a replay of the webinar on our YouTube page later today. And for those of you who are watching this back, you will also get an email with the video as well to watch it on our YouTube page. So I wanted to go ahead and thank you, Beth and Jeffrey, for joining us today and giving us the presentation on PopSole. We definitely appreciate it.
Thank you.
Thanks, Jordan.
We really enjoyed it.
Yeah, absolutely. All righty, everybody. Well, everyone have a wonderful rest of the day, and we'll be back again soon.